The other day, my friend said that she was going to get on her husband's Medicare. He's almost 65, but she's only 60, so is that possible? It made me wonder who can get Medicare, so in this video, we'll talk about that. We'll also look at other eligibility requirements, how being single or married can affect your costs, and whether you can have Medicare and Medicaid at the same time. So let's jump into it. It's important for people to know when they will become eligible for Medicare so they can take the right steps to be prepared for enrollment. Here's when you might qualify before you turn 65 if you have certain disabilities or illnesses. If you've been collecting disability benefits from Social Security for 2 years, you'll be automatically enrolled during your 25th month. If you have Lou Gehrig's disease, ALS, you'll be automatically enrolled the month your Social Security disability benefits start. If you have end-stage renal disease, ESRD, you might qualify for Medicare, but typically you have to enroll through Social Security. Enrollment isn't automatic in this case. Even if you qualify by either age or disability, there is also a U.S. residency requirement. So, are you a United States citizen living in the U.S.? Are you a permanent, legal U.S. resident of at least 5 years in a row? If you answered yes to either of these questions, you're most likely qualified. If you're temporarily living in another country, contact Social Security to see if you're eligible for Medicare. Let's talk about signing up. If you're already getting Social Security benefits when you qualify for Medicare at age 65, you're automatically enrolled. You'll get your card in the mail. If you're not automatically enrolled, you'll have that opportunity during your Medicare initial enrollment period. This is a 7-month window starting 3 months before your 65th birthday month. You can go to the Social Security website, ssa.gov, to enroll and get more information. Let's talk about Medicare if you're married. It's important to know that it doesn't cover your spouse like health insurance plans you may have had in the past. It's for individuals only. But let's look at a benefit that may apply. It has to do with your Part A monthly premium. If you don't know already, Part A is your coverage for hospital-related costs. If you have paid Medicare taxes for 10 years or more before you turn 65, the premium is typically free. If you haven't paid those taxes, but you're turning 65 and now eligible for Medicare, there might still be a way to get that free premium. Here's how that works. Imagine that Judy just turned 65 and qualifies for Medicare, but she was a stay-at-home mom for many years and hasn't paid into Medicare insurance for long enough to qualify for a premium-free Part A. Now, her husband Jack is only 62, and so he doesn't qualify for his Medicare yet. But because of his long work history, paying into Medicare taxes for over 10 years, he qualifies his wife for that premium-free Part A. Part B is your medical insurance, like doctor visits, and that's a different story. Almost everyone pays that monthly premium. But let's look at that cute couple again, because this scenario might apply to you. If Jack is covered under his employer's group health plan, Judy might already be covered under his plan. So to save herself some money, she might want to postpone enrollment in Part B. She should still probably call the benefits administrator at his work to double-check on that. Just remember though, when Jack's group coverage comes to an end, she should sign up for Part B quickly to avoid a late enrollment penalty. We have a video that tells you more about that if you're interested. It's titled, How Does Medicare Work with Other Types of Coverage? And speaking of other coverage, a question that's often asked is, can you be eligible for both Medicare and Medicaid at the same time? If you didn't already know, Medicaid is a totally different government assistance program. It's for people of any age who qualify based on income or disability. If you qualify for both Medicare and Medicaid at the same time, it's called being dual eligible, and yes, it's possible to qualify for both. We have a video that covers that in depth as well, if you're interested. Take care.